Hi, my name is Chris Welbeek, and I'm going to be talking about my final project. And I'm going to share my screen. For my final project, I chose bipolar disorder. I chose bipolar disorder because my cousin Zach was diagnosed with bipolar disorder at age 15. For my final project, I am focusing on male adolescents between age 15 to 18 years old. I am first going to talk about the suicide risk. It has increased to 22%. It has increased to 22% due to serotonin uptake inhibitors. That's increased manic episodes and hallucinations. It has also increased to 22% due to adolescent males having major depressive episodes. Some risk factors I found for bipolar disorder are cognitive disorganization that includes hallucinations and negative psychological symptoms, genetic correlation, social isolation, and psychological experiences. And then protective factors I found for bipolar disorder are resilience, coping strategies, emotional regulation that plays into child's adolescence, positive and negative experiences on their body. And now I'm going to talk about two assessments that I did for my final project. I'm first going to talk about the Patient Health Questionnaire 9 assessment. For the Patient Health 9 Questionnaire 9 assessment, I would ask the client these 9 items, questions. I would ask the client, do you have little interest or pleasure in doing things? Are you feeling down, depressed, or hopeless? Are you having trouble falling or staying asleep, or are you sleeping too much? Are you feeling tired or having little energy? Do you have poor appetite or overeating? Are you feeling bad about yourself, or have do you feel like you are a failure in life? Or you're letting your family down? Do you have trouble concentrating on things such as reading the newspaper or watching television? Are you moving or speaking slow? Do you have thoughts thinking that you'll be better off dead or hurting yourself in some way? I would ask the client these 9 items of questions, and I would score them, and then I would add up their scores, and then I would take a average, and then at the end I would ask the client, do you have problems in at your work or taking care of yourself at home, or do you have problems getting along with others overall? And then by doing this questionnaire, I would diagnose how the client is doing, and I would diagnose their level of depression. And then another assessment I considered was the suicide questionnaire revised assessment. I would ask the client these 4 items of questions. Do you have thoughts thinking that you'll be better off dead, or you have are thinking about attempting suicide? Have you often thought that you'll be better off killing yourself in the past year? Have you ever told someone that you were thinking about committing suicide, or you were thinking you might just do it? How likely would you attempt suicide someday? I would ask the client these 4 questions, and then I would score them, and then I would add them up, and then I would take a average. And then a strategy I found for my risk factors and my protective factors are cognitive schemas. Cognitive schemas operate self-destructive behaviors and maladaptive schemas. Cognitive schemas are a child's behavior, social, and psychological functioning about oneself and one's self one's effect on their worldview. Therapists have clients organize information to help them encode and think in their thinking and behavior. Therapists will have the clients talk about their feelings and behaviors to try to help clients with their decision-making process. And then for post-Benson, I considered cognitive behavior therapy. Cognitive behavior therapy focuses on the client's self-image and the client's identity. The therapist will have the client do 4 to 12 sessions between the family and the client to help the client become more aware of their emotional and behavior difficulties. The therapist will have the client talk about their experiences to help the client make decisions by talking about their thoughts and their emotions to help them grow in their confidence. And then what did I learn from this class? Emotional regulation plays into the child's positive and negative experiences that can affect their adverse life experiences. This is often seen in adolescents, and it's often seen in children's adverse child experiences, also known as ACEs. Cognitive schemas are children's experiences that are behavior and social and psychological functioning about one's self effect on their worldview. Therapists have clients organize information to help clients encode their information about their thinking process and behavior. And then what did I learn from this class? The behaviorist model focuses on face-to-face interactions between a client and the therapist. The behaviorist model has resources such as B.F. Skinner and Horstman, who argue that behaviors are rewarded and reinforced through social interactions with others. As a future clinician, I would use the behaviorist model by aligning it with cognitive behavior therapy. As a therapist, I will use cognitive behavior therapy to interact with my clients, to have them see how their thoughts and emotions impact their decision-making choices. And then how has this class changed my outcome on suicide? As a clinician, we must look at clients' culture and evidence-based practices to help clients build resilience to suicidal behaviors. And then that is pretty much all I have. And then here are my references. And then I also made a reference document that I will be uploading to Blackboard of my final project. And I'm going to zoom in there to help you see my references. And then that is pretty much all I have. And thank you for watching, and I enjoyed this class.